Hello, class. Welcome back. This is going to be a short video today on tumor staging and grading, and also on therapies for cancer. And this is just a continuation of chapter 4, which involves neoplasia. So let's continue. Tumor staging and grading. Okay, we'll start with staging. I want to say both of these particular topics involve assessing what you've got going on with both the tumor and the cancer cells that are part of that tumor. So when you're looking at the tumor itself, you're talking about staging. And this is the results of a gross examination or surgical removal or radiographic findings, that sort of thing, where you can get a good look at what the tumor is like and what it's doing. So staging will evaluate the size of the tumor and also if it has spread. So if we have metastasis going to the lymph nodes and distant sites, or possibly both. And the staging will be graded from 0 to 4, with 0 being the least possible problem with the tumor and 4 being the greatest. So this shows what I'm trying to talk about here. So you have stage 0 to stage 4. So you can see stage 0 is the smallest tumor that's detected, and then it continues to enlarge and grow as it gets to this final stage. Also during the process, you see the development of blood vessels going to the tumor as it gets larger, and this is just to provide the nutrients and the oxygen that the tumor needs to continue developing. And then eventually you'll see spread into the lymph nodes here and here and here. And certainly in stage 4, this is where there's been spread from lymph nodes outside of where the particular tumor is located to other areas in the body, and also a spread to other organs. So grading, this time we're actually evaluating what the cells are looking like and what they're doing. So this is done under a microscope. And again, we're looking at the same values from 0 to 4. So a low-grade tumor is a cell that looks more normal and usually will grow and spread slowly. And there you have your 0. And then when you get to your high grade, this is where the cell is looking more abnormal and is acting much more aggressively. And you see growth and spread that happens very quickly. And that would be a 4. So again, 0 to 4. Treatments. Okay, there are many types of treatments nowadays. We have the conventional ones that you're probably most familiar with. And these involve surgery where you remove the tumor. Always will have to remove a lot of normal tissue around that to try to make sure you've gotten everything out. Then you have radiation, where you have a beam that's very localized, but it's high doses, of course. You have to try to burn out all these cells, and you will injure tissue in that process. Then there's chemotherapy. So here you're in effect trying to poison the cell. Problem here is that it is systemic treatment, and so that will affect all parts of the body. That's why you see the hair loss and other side effects. And it is only effective against rapidly dividing cells. That's a very important concept. We'll be talking about that more next week. And then we have hormonal therapy. So there's certain tumors that can develop, and that's seen commonly in breast cancer and also prostate cancer, that actually are fueled. Their growth is fueled and the spread is fueled by the particular hormone that they're sensitive to. So in breast cancer, that would be estrogen, and in prostate cancer, that would be testosterone. So one way to treat these cancers is to actually control and eliminate the secretion of these hormones. So all of these treatments will cause some form of collateral damage and necrosis, tissue necrosis, and quite often the side effects of these treatments is very severe and also can be actually worse for the patient than the original cancer. So scientists have been looking for ways to achieve cancer treatments without all these side effects, and they are turning now more and more to immunotherapy. So this is a treatment that is much more host friendly. It's using the patient's own immune system to fight the cancer cells. It can create memory T and memory B cells. And the idea is to prevent relapse, which is not uncommon, unfortunately. And also, the key here is to induce apoptosis, not necrosis, so that you're really trying to eliminate all those tissue side effects and damage that's occurring. And this is the real future of cancer treatment. So here you have your normal immune response. This time it's for a tumor cell, and you can see we have a variety of antibodies that are actually attached to the cell. Those antibodies are generated by the B lymphocyte. Then you have, of course, your T killer cells and your natural killer cells. This is all of your lymphocytes here that are working at trying to eliminate this tumor cell, of course. And then also involved are macrophages and neutrophils. So you have the whole gamut of cells from both the innate and the adaptive side that are going after the cancer cells. And unfortunately, because DNA is so unstable and mutates so much, it is not uncommon to develop cancer cells throughout your life. I mean, they're constantly being formed, but your immune system is actually constantly taking out these cells. So the important thing is that you have a good, strong immune system and a tumor cell that can't evade the process. But some of them can, and they have developed ways to resist and evade the immune cells. So one way is that they will alter their receptors to avoid detection. They can also form new receptors, and that will disguise the tumor cell, cancerous cell, as looking like a normal host cell. They can also hibernate in normal tissue and then reappear years later. So this is where you see these relapses occurring. And finally, they can actually alter and recruit immune cells to protect the tumor, the developing tumor, and actually aid in its growth and spread. So that's one of the reasons why cancer treatments are not easy and why the fix is not an easy one. So let's talk about more of forms of immunotherapy. So the perhaps the oldest type of therapy that's been around has been achieved through injections. And here the tumor is directly injected with non-disease causing bacteria and viruses. So this will stimulate local inflammatory response. So you get a variety of immune cells that are drawn to the injected tumor, and they are able to recognize it and then kill the tumor cells. So this is a treatment that's used for bladder cancer, but it has to be very early cancer. So we're looking at stage 0 to 1. Anything beyond that, the treatment has not been found to be effective. Vaccines, this is another important form of using your immune system to in this case, prevent cancer. So there are a few vaccines that have been created. The one that you may be most familiar with is the one that targets the human papillomavirus. And so those vaccines have been quite widespread now. Most people have had them at some point. And they are designed to prevent oropharyngeal, genital, and cervical cancers. Now, another vaccine that I'll mention is actually the vaccine for hepatitis B that probably everybody here has already had, and I believe it's a requirement in getting into this field. That has been found to prevent certain liver cancers. So that is another example of where vaccines have been very effective. So more recent advances involve primarily two aspects of utilizing the immune system. One is something called CAR T cells, and this is where the patient's own T cells are genetically altered to, that's done in a lab. These cells are removed from the patient's body. And then once they are altered to be able to target and kill cancer cells, then they are actually reinfused into the patient. So this is something that was approved for treatment officially by the FDA in 2017. And I will be talking about this a little more in next week's lecture. And then we have monoclonal antibodies. So you've probably been hearing about them in terms of treating COVID. And in effect, they are very good. They've been very good at counteracting infections with the Delta virus. But there's a big question mark about if they still can go after the Omicron. So right now, I don't believe they do. So they're not really being used that much anymore. So monoclonal antibodies are made in the lab, and they are designed to bind onto the receptors of the cancer cell or to certain receptors on immune cells. I'll be talking about that more in a minute. What they can do is they can be altered in such a way that one end of those arms will actually attach to the cancer cell, and the other arm on the antibody will be able to bind to the cytotoxic medication that is actually needed to kill that cancer cell. And in this way, the cancer can be eradicated. So the idea is to use these monoclonal antibodies to block or stimulate responses from whatever cell is particularly targeted. So that kind of leads us into our discussion on checkpoint inhibitors. We can beat cancer. So there was a Nobel Prize awarded in 2018 to two researchers. One is an American, James Allison, and the other is Japanese, and his name is Tashuku Honjo. And they both worked on developing monoclonal antibodies that actually would target, believe it or not, the immune cells to make them fight the cancer more effectively. So it's a kind of complicated, kind of confusing, I should say, topic. So I hope this will help clear it up a little bit. So before, when we talked about the brake is off, we had talked about the cancer cells. We had said that a normal cell has a brake that is on, that does prevent the cell from continuing to divide and reproduce and spread. So there's a brake that prevents that. And when they turn cancerous, the brake is off. And then they can just multiply and spread, and that's cancer. So here the brake is off on the immune cell. In other words, the medication is trying to create the situation. So something that's holding the immune cell back is now being removed. So the immune cell can do what it needs to do. So it turns out that normal T cells will synthesize certain receptors that prevent them from recognizing and killing cancer cells. And this is done to control the immune response. So we're back again to having a pro-immune response and a negative immune response. So you get to that certain point where immunity has to be shut down and shut off, so it doesn't just kind of run amok and cause havoc like a cytokine storm. So the researchers were able to identify two receptors that are involved with this. So one is the PD-1 and the other is the CTLA-4. And there are others now that have been discovered, but these were sort of, the first ones and the main ones involved. So what they did is the researchers developed the monoclonal antibodies that would interfere with the workings of these two particular receptors and keep them, by doing that, keep them from turning off, in a sense. They would stimulate these cells to again be able to recognize and kill the cancer cells. And that's exactly what happens. It's primarily the T helper and the T killer cells. And by blocking these particular receptors, they are now what is called unleashed. They can now go out and start destroying cancers again the way that they were originally designed to do. And then this video, you do need to watch this. It will explain this even further. And I do find this very interesting. So be sure to watch this, because this is material you will need to know. And finally, the last slide here. Perhaps the most famous person so far that I know of that has been treated successfully with these particular monoclonal antibodies is President Carter. So he actually had stage 4 melanoma, so it had spread throughout his body and it had gotten into his brain, and they were giving him only a few weeks to live. And then they decided to treat him with the PD-1 inhibitor known as Keytruda. That was in 2016, and actually the disease was completely eradicated, and he is in complete remission and doing very well. He's back to normal. And as I mentioned in class, he's actually very actively involved with Habitat Humanity and has helped build some homes here in Mishawaka a few years back. So that's all, the end. And I will see you in class on Tuesday. And again, if you have any questions about this, don't hesitate to ask or get in touch with me so I can clear it up for you. Have an enjoyable weekend, and I will see you on Tuesday. Take care.